Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah, Manager of Community Health Improvement at Kaleida Health. You are listening to us on WUFO, Power 96.5 FM, WUFO AM 1080, or you might be listening, or you might be streaming us and listening to the program. But I want to welcome you to the Great Lakes Health Radio program, Kaleida Health. And I just want to mention that Kaleida Health, we are Buffalo General Hospital, Millard Fillmore Suburban, and Oshai, the Children's Hospital. The new name is now Golisano Children's Hospital of Buffalo. So what was before Oshai Children's Hospital is now Golisano Children's Hospital of Buffalo. We also have the Visiting Nursing Association, and I do believe I said Millard Fillmore Suburban, and the Gates Vascular Institute. We have two long-term care facilities. That is High Point on Michigan and DeGraff. DeGraff in North Tonawanda. We're also in North Tonawanda on the same campus as DeGraff is a urgent care, but it's not urgent care, but it's a DeGraff care emergency medical center where you can still go for your health care, especially if it's an emergency. And we have health clinics throughout. We have clinics throughout Buffalo, the south of the city, north of the city, Olean, Bradford. So we are in many locations, and it's Kaleida Health, over 13,000 employees. And our guest for today, good morning, Roberto. How are you?
Good morning, Francesca. Thank you for having me in your show.
Oh, you're welcome. And Roberto is Roberto Bonilla. Bonilla?
Yes, Bonilla. Yes.
Okay, Roberto Bonilla, and he is the manager of Community Health Improvement. Same title as I have, but we work in different areas. Our topic today is the 1115 waiver screening for individuals who are on Medicaid or Medicaid eligible. And I'll let Roberto explain that to you. The reason why I have Roberto, I've been working in this department now for about 3 weeks, and the things that the services, this department of health, community health improvement has available to the community is mind blowing. One of the things we have, and that's why we have Roberto on the show to talk about it, are microwaves and refrigerators. And how do you qualify for this? What is an 1115 waiver? So anyway, Roberto, if you could just begin by saying, please explain the 1115 waiver and why it's important to our Western New York community.
Of course, Francesca. So the 1115, I'm just going to start saying that the 1115 waiver is a Medicaid initiative to screen all Medicaid members for health-related social needs. These funds are assigned by Medicaid to Western New York, and it's important for our community to take this advantage of this funds and these resources that are available for them. Our role in the 1115 waiver is basically to screen all individuals that have an active Medicaid, so we can identify their health-related social needs and then help them navigate and link with those service providers that will deliver those services to them.
Now, I've heard of other organizations with 1115 waivers, and so today we're just speaking about the Kaleida. And how can one apply for the 1115 waiver? How do you go about that?
Great question. They basically have the WINIC is the main entity that manage all these social care networks, but Medicaid members can reach out to us directly. I can provide our phone numbers. It only takes between 10-15 minutes to do the first screening and the eligibility screen. So they can reach out to our team here at Kaleida Health, I'm going to provide you with two phone numbers. The first one will be 716-370-1051 and 716-387-2632. We will take their information. All they need basically is the SIN number, the identification number from Medicaid. If not, we can help them get that number. And again, 10 minutes, we will ask a series of questions and screen them and determine if they qualify for services.
Now, I remember watching you talk to people when the Near East and West Side Task Force had Passport to Wellness. So were people having a conversation with you and applying for this 1115 waiver at the same time?
Correct. Yes, we will ask questions regarding housing, nutrition, transportation, and we would identify those health-related social needs that Medicaid members will have, and we can help them connect with services. Yes.
Okay, because I was observing. Um, so I was also reading, or maybe it was looking at the flyer where it talked about another term that's often used, social determinants of health, and I call it social determinants of life. But how does the 1115 waiver work with individuals and families who are part of what we now call social determinants of health, and I call social determinants of life? How do the two work together?
Great question. We will, on the 1115, obviously, this is a screening, so we will identify those those social needs that families will have, individuals will have, so we can close those gaps, so we can reduce this health disparities in our community. Again, we will identify housing needs, nutrition, transportation needs, even cooking supplies that you mentioned. We can identify individuals that need a new refrigerator because they don't have one to, so they can storage their food, and microwave cooking supplies. So we want to help individuals close these gaps and and reduce these disparities in our community.
Now, you just mentioned a few things. What services, like what are the questions that would trigger if someone needed um, an appliance? And what's the other, you said, yeah, what are some of the questions that are asked when the person who is applying, that you are able to, prove that they are on Medicaid? So what are then the questions that would make one eligible for the services? And so let's start with the kitchen. And so what are the things you would supply for a kitchen? What makes one eligible? And does someone come to the house to make sure that that's what they need?
Great question again. So basically, Medicaid will identify um, individuals that need support. That's the first thing that Medicaid will do. This screening, most of the time, identified automatically. Medicaid members in need with medical condition. If that's not the case, like it happens with a lot of children, we can also send an attestation form to your medical provider for them to confirm that the Medicaid member has a medical condition and is entitled and eligible for these extra services. Now, that's one part. The other part is we ask individuals if they have stress finding food. And if they said yes, very often I don't find fresh vegetables. I don't have access to, a fresh and healthy products. That will be one question, and we will refer that individual for food provisions. We also ask them, how is your refrigerator working? How do you have a microwave? If they say no, this is a verbal answer. We will not send no one to their homes to verify this information. This is all verbal, And if they need a refrigerator, we will refer them to receive a new refrigerator. Housing, we ask, do you have a steady housing where to stay every night? Sometimes they don't have, they might feel homeless, and we that way we can refer them for housing assistance. Transportation, do you have a reliable transportation? This is just questions that are verbal questions. We ask them, they answer yes, no. um the same for like pest control. If they have, we can also help with home remediations. That's a great one for asthma, and for pest control. But again, this is all free. Also, I have to mention all these services are free of charge. Medicaid is not going to charge no one for these extra services and these resources. And most of the time is a verbal answer.
Mhm. You know what? Can you just say what you just said? Can you, because I know we have listeners who are also speaking Spanish. Can you just repeat what you said about the services that are free and no one goes into your home? Can you just say that in Spanish? And so just in case we have listeners who understand Spanish, can you do that?
Claro que sí, of course.
Okay.
Um, Nosotros aquí en Kelaida estamos haciendo estas preguntas a miembros de Medicaid que tienen Medicaid activo para identificar necesidades sociales como provisiones de alimentos, utensilios de cocina que puedan necesitar las familias, como refrigeradores, microondas, utensilios de cocina. Podemos ayudar a remediar los problemas en la casa con asma. Cuando tienen niños que tienen asma o adultos que tienen asma, podemos ayudar. Si tienen insectos en la casa, también podemos ayudar. Con transportación, si no tienes hogar, nos puedes llamar, podemos conectarte con agencias que dan servicios de casas para que puedas obtener un hogar. Todos estos servicios son gratuitos. Nos puedes llamar al teléfono 716-370-1051 o al 716-387-2632. De nuevo, es un servicio gratuito, solamente nos toma 10 a 15 minutos entrevistarte y poder conectarte con servicios. Muchas gracias y esperamos tu llamada aquí en Kelaida Health. Thank you, Francesca.
And you're welcome. And did you say your name and give the phone number as well?
Yes, I did. Roberto
Okay.
Bonilla y mi teléfono otra vez, 716-370-1051. Yes, thank you.
Thank you. This information is just way too important for just one language. I mean, and I know we've discussed this at our meetings in interpretation. So is it you? So how does someone get in touch with you to come to their church or their health fair, or is there a team? How do you work? I mean this is huge. How many people in Western New York are on Medicaid? Do you know how many people?
Oh my God, it's really high. I don't know exactly the exact number, but as Kelaida employees, we know that 80% of or more of our patients sometimes are Medicaid. So it's a reflection of the community too, I will say, right?
Right.
So yes, it's a lot of people that have this opportunity to take advantage and to have those gaps closed. And we here to assist you. And please, you can reach out to me at my phone number that I give, and I will give it again, 716-370-1051. Please let us know when you have a community event at your church, any community event that you might have, even in different, if you know other cultures that we have in the city of Buffalo. We have translators. We can help people in other languages, like Francesca mentioned before. But please let us know when your activity is, and we will go there and support our community like we always do. We work with the schools, with church. We work with anyone in the community that wants our community to continue to grow and be healthy.
Thank you. You had said, so if someone needs a refrigerator, is it a full refrigerator? Or is it like a little college refrigerator? Like what kind of refrigerator is it?
Good question. It has a max dollar amount by Medicaid, so I have not seen the refrigerator, but it's not a. If people request a mini refrigerator, they can actually get a mini refrigerator. I believe the dollar amount that they can go up to is $600 for a refrigerator. So, but it's I mean they use Lowe's, they use companies out there that will deliver these refrigerators, and the service providers always coordinate the logistics with the Medicaid members and whatever, and try to meet as much as they can those needs.
And the other thing you had mentioned, you said so in case someone needs utensils. Did you say utensils?
Yeah, cookingware, silver plate, I mean silverware, a new set for a plate set, nice glass cups, a set of knives to cook, to help you cook, and measure cups, anything that you need, air fryer.
Air
Uh,
fryer.
yeah, they can get an air fryer.
Great.
Anything that they will do, the service provider will contact the member and they will discuss their needs. And if it's available, they will get this service. Yes.
Wow, that's amazing. And a microwave you said as well,
And a
right?
microwave of way as well, correct.
Mm-hmm. When you talk about transportation, what type of services are you able to provide the family on the east or west side? Um, what types of transportation do you provide?
That's a great question. The waiver provide non-medical transportation needs, because they already have the Medicaid cap, stuff like that for
Oh, I see.
medical needs. There will be no medical needs. It can be to address your housing needs with social services, to go to the court for an eviction, or any court, unfortunately, any court date that you might have. It will help you go and get food supplies for your family, to go to the supermarket. They may be able to help you with that. Any need that is not medical related, these social providers will connect Medicaid members with whatever they need might be.
Mhm. Now, is it you or slash your team that helps the connection, or is it up to the individual? So let's say to make that connection.
That's a great question, Francesca. We are screeners, which is the first phase to start, and then we are also navigators. Navigators mean we will do the eligibility screening for them, and we will connect them with service providers for whatever need they have. What I'm saying about service providers is we have a number of service providers or agencies that are providing food provisions. To members. So we can, if we have two or three in their area, we can mention it to the member and they can select one. Sometimes people are spreading the word, oh, give me this agency or that agency. They already know which, the services that these agencies are providing, either in food provisions or cooking supplies or transportation or housing. So they can select the agency also. But
Mhm.
we can provide the names of who's available at the
Right.
time of the screening, and they can select. Yes.
And is it a one and done communication? So once you see the client and you give them the information, if they have questions, can they call you back, or is it one and done?
No. Yes. Absolutely. We can help you navigate through. We can get you navigate throughout your services, and this screening is once a year. We can, if you qualify for services, we can help you navigate throughout the time. You can call us every day, whenever. We will assist you with that navigation, that communication with the service providers. But if you have a life-changing event, like moving to a new home, lost a job,
Or you
lost
have a cancer
lost a
diagnosis or something?
something, you can actually get another screening done if you had a lifetime changing event. Yes.
Okay. Okay. Well, that's and again, that would be up to giving you or your team a call.
Yes, we are here. And again, I have the phone number 716-370-1051. Please call us. We're here to assist you and support.
Thank you. How about now, and we didn't mention, because there are thousands of people that gather every Sunday at different houses of faith, homes of faith. Do you or your team go out on Sundays?
We can coordinate, of course. We can coordinate. We're here to serve the community. So if an opportunity presents, we can be there in present and support our community. Yes, just call us and let us know, and we will be there present for you.
Oh, okay. All righty. How about anything else? We have a few minutes left, but at this point, I'm going to stop and let you tell tell the listeners something that we haven't covered.
Well, I think we covered the most part, but again, this screening only takes 10-15 minutes. We can screen every single member of your household. So it's not only one person that we will screen everyone. And if multiple household members qualify for services, they can receive these services individually too. We come across sometimes two families living in one home. If both families are green and both qualify, both families will receive the services at the same unit, if that's the case. Again, we want to close those social determinants of health. This is a great opportunity for us to assist you and support you in your need. So please feel free to call. We're here. This is what we do. This is what we love to do, to serve you and help you. So feel free to call us at any time. Text us. You can also text if that's your if you wish to do that. You can also text at 716-387-2632. Please, this service is for you, and we are excited to be part of this initiative by Medicaid because we know that it's impacting our community, and that's that's what we want to see.
Yeah, and again, don't be ashamed. Another question. You said you can screen every member in the household, but if there are, let's say it's a flat and there are 8 people living in the house in the one flat, they wouldn't each receive their own microwave, would they?
Well, no, they might if they're moving away in a month. We don't know, but they qualify.
Okay,
They
they
might
might.
receive that. Yeah, it's a case by case that they can discuss that with the service provider. But if the need is there, um, they will receive the service.
And if someone is, a listener and they heard you speak Spanish, I'm just wondering, do you speak any other language that you would be able to interpret?
I'm trying to continue to learn Italiano and Portuguese, but not there yet.
Not there yet. Okay. So as you know, as you heard Roberto translate in Spanish, so if it's an event where the majority of your population is Spanish speaking, think about having Roberto from Kaleida Health manage your community health improvement at one of the tables. And again, there's also someone from our team who does lead prevention and right, lead prevention, lead abatement.
Correct. Yes, we have a team that does a lead prevention. We have care coordination programs. Yeah, so we can help in many ways. And this screening is like a starting conversation. It comes many times, Francesca, that we referral families and individual to other services that are not part of the Medicaid waiver. But as you know, as Kaleida Health, we have so many resources that we can help families connect with providers, connect with care coordination, with whatever they needed. So this is a great opportunity of having a conversation, and help our
Yeah.
community.
Yeah, so and that's also part of the team. We have the like Roberto said, this the screening, 1115 waiver screening, lead prevention, care coordination, doulas, someone very knowledgeable and talking to you and your group about breastfeeding to women, So we have it's an amazing department, and our the it's led by Vicki Landis, and Vicki is an incredible supervisor. Um, Coordinating all of these different services for the community. And Roberto is just one of many of our many of the team members that I work with, who you will be hearing from throughout the year. And also, you will be this is a show that will also be not only repeated but lives on our website. All the Great Lakes Health radio programs, I should say the past 3 or 4 years. If you go to Kaleida Health website or Google Great Lakes Health Radio, comma Kaleida Health, Kaleida, you will hear this program as well as other past programs that you may want to share with your PTA, your PTO, your Girl Scout troop, your Boy Scout troop, your deacons, your deaconesses. The list goes on and on. Your healthcare providers. So Roberto, I want to thank you so much for being our guest this morning on the Great Lakes Health radio program. Thank you, Roberto.
Well, thank you, Francesca, for having me in this great show of yours. And I'm glad to be here, and hopefully we can continue to help our community and supporting them. Thank you for having me.
Oh, you're welcome. And look for us in the community because we're back. We never left, but we are back. 100% full steam. And on that note, I want to thank you for listening to the Great Lakes Health Radio program here on WUFO. And I'm your host, Francesca Messiah, Manager Community Health Improvement at Kaleida Health. Next week, you will hear from my esteemed colleague from ECMC, and that is Cindy Bass. And until then, stay warm, be comfortable, and cheers to your wellness. And now on to part two. Welcome back to the Great Lakes Health Radio program here on WUFO, Power 96.5 FM, WUFO 1080 AM. Our topic for today, and it's very important, it's colonoscopies, colon screenings, and I just want to say that this is a topic that a lot of people shy away from. I'm going to raise my hand. I know you can't see me raising my hand. I've had one, and it was a great experience. Do not be afraid of it. People talk about the prep, but you know what? You're asleep. But I'm not going to steal the thunder away from our guest for today, who's going to talk to us about colonoscopies, and that's Dr. John D. Ortolani, who is a colon and rectal surgeon, assistant professor at the UB Medical School in the School of Surgery, and he's also a surgeon right here at um, um, Buffalo General Medical Center, which is part of Kaleida Health. Good morning, Dr. Ortolani. How are you today?
Good morning, Francesca. Thanks for having me. I'm great.
Oh, you're welcome. You know what, Dr. Ortolani, and I want to thank you for, again, a few years ago, I had one. You were my physician, and it all went well. So thank you. But for our listeners, what is the purpose of the colon, and why is colon screening important?
Sure. So essentially, the colon and the other name for it is the large intestine. So sometimes our listeners may hear it described differently as the large intestine or just as the intestine, but it's essentially the lowest part of the GI tract. And essentially, its role is to absorb water. So there's really nothing more glamorous than that in terms of what it does. It helps to take the output from the small intestine, which is mostly liquid. It absorbs that water back into the bloodstream, essentially, to allow you to maintain your overall fluid status. And then the remnants of that essentially turn into stool, which is what you evacuate. And so the colon's job is to absorb that water. There are some electrolytes that also are in play in terms of the colon, but really nothing more than what we talked about. So in terms of why it's important, as far as screening goes, we know that colon cancers and rectal cancers typically start off as small polyps or growths in the colon. And we know that if we can identify those growths when they're small, typically they haven't turned in anything worrisome yet. And B, we can actually manage them while we're in the middle of the procedure. So we can actually remove a polyp that we see during a colonoscopy. So the benefit to the patient is we've removed a potential growth that could cause problems in the future, and we were able to do it all while visualizing the colon. So it really offers both a diagnostic and a therapeutic effect, which is most beneficial to the patient.
And one of the most important things you just said, in case someone got a little squeamish or something, you're asleep. You don't know. So you're not feeling this. So
Correct. We do this under what we call moderate sedation. So patients are given pretty strong sedative medications and analgesics to really get them comfortable. We typically call this conscious sedation in the sense that you're able to maintain your own airway. So this is not like a surgical procedure where we need to put a breathing tube down to help you breathe. This is you're breathing on your own, you're maintaining your own airway. We're just giving you medication to make sure that you're not feeling what we're doing and you're not cognizant of what's going on.
Mm-hmm. Yeah, thank you. At what age should one consider getting a colonoscopy? And does it matter if you have a history of colon or rectal cancer?
It's a great question. So, up until a few years ago, the standard screening age for colonoscopy was age 50, and that had been the case for many years. Unfortunately, there's been some newer data over the last 5 to 10 years suggesting that younger patients are developing colon and rectal cancers earlier than we previously understood. And so, after a large analysis of databases across the country, the recommendation was made to lower that screening age. And so it is now 45. So we recommend any patient at 45 start the process of getting in for a colonoscopy just as a screening test. Again, we're hoping not to find anything, but as a screening modality, it's recommended for age 45. Now, if a patient has a family history of colon cancer, and that can be a mom, a dad, a sibling, or a grandparent, we typically recommend that screening be done either at age 40, so even earlier, or 10 years younger than the earliest diagnosis. So, for example, if you have a mom or dad who is diagnosed at 47, then we'd recommend that person get screened at 37. So you can see we're pushing into the younger years, and unfortunately, that's because we're finding colon and rectal cancers and even advanced colon and rectal cancers at earlier ages.
Yeah, so that's a great point. Let's say someone is they're in a hurry, can't finish listening to the entire show. To make an appointment to see you or one of the surgeons, do they have to have a referral to their primary care, or can they just contact your office for a colonoscopy screening?
Either way, almost all insurances are covering screening colonoscopies simply because of the benefit for the patients overall. So generally speaking, patients will get authorized and approved for that, and there won't be an issue. If they want to reach out to our office directly, they can. Our main phone number is 716-636-9004. And that's for our main office. There's 8 of us that are colorectal surgeons in our group. And then, but certainly we would accept a referral from a primary care physician who wants to send a patient over, and we can initiate the same process that way. It really is, either option would work.
Mm-hmm. Question, only because it's, the weather's getting nicer, people are visiting. What if somebody is visiting from out of town? Let's say they're visiting from Virginia, and they're like, "Well, I have some time. I can get a colonoscopy." Can someone, do you know, from another state come and get, if they feel that they really need to get a colonoscopy, can they get a colonoscopy here, or do they have to go back to their state?
It really depends on the insurance and exactly what is included in their plan. Most plans are pretty state specific and will only include, say, emergency care in another state.
Okay.
So a colonoscopy probably wouldn't be approved, at least your typical elective screening colonoscopy. But that being said, there might be specific plans that would allow you to get a colonoscopy anywhere, and in that case, that would be perfectly acceptable.
Mm-hmm. Okay. And just your phone number one more time in case somebody pen ran out of ink.
Sure. It's 716-636-9004. And when you call, you'd speak to one of our front office staff, and they would typically, ask what you're calling about, and you'd say, I'm interested in getting a colonoscopy or a screening colonoscopy, or if you just say your age and that you haven't had one before, we would typically get you to one of our schedulers who would then look at the schedule and get you added on pretty quickly for a colonoscopy. Most of us in our group do colonoscopies, maybe 4 to 5 times a month in terms of different days of the week. So we can usually manage anybody's schedule, whether they prefer a certain day of the week or a certain time of the week. And then we can make sure we get you scheduled ideally within the next couple of weeks to a month after you call.
And then typically with a colonoscopy, after you go through the procedure, can you return to work? Or is it recommended you rest up for the day?
So typically the day of the procedure, we ask you not to go back to work that day, mainly because the medication that we've given you is sedating. And so it might be hard to perform your job. It might be a safety issue if you're working with machinery or driving. Certainly, we ask you not to do any of that the day of. The next day, however, you can do anything. So there's no restrictions after the day of the procedure. We ask you really afterwards to try to go home. You can eat whatever you want when you get home, but essentially just take it easy and rest. And then the next day you can go back to full activity.
Okay. Thank you. Are all screenings the same? And the reason why I ask that commercial, because there are so many commercials on television that talk about all these kits. And so are all screenings the same?
That's a great question and very pertinent because, as you said, most of our listeners will have seen advertisements on TV or on the radio or online about these different modalities. Essentially, the way we think of it, the best screening test for any individual patient is the one that's going to get done. So, when you're trying to screen a population, you're really trying to make sure that everybody at some level is getting access to whatever it is that we're trying to prevent. In this case, it's colon and rectal cancer. The gold standard, still the gold standard, at least by all the different surgical and medical societies, as far as the best test, if you ask me to pick one, it would be a colonoscopy. And it's for the reasons I mentioned earlier, because it's both diagnostic and therapeutic. We can identify a problem while we're in the middle of the procedure. And most of the time, unless it's a big mass or something that we can't address, we can deal with it while we're in there. So we can remove a polyp. We can, deal with it while we're in the middle of the procedure. That being said, there are several tests out there now that also do a good job. The one you've probably seen most frequently on TV is the Cologuard test. And essentially that's a test that looks for DNA in the stool that is high risk for potentially an advanced colon polyp, so a larger polyp, or a colon cancer. Essentially, this involves you get a kit sent to you, you have a bowel movement, you use part of the material they send you to collect some of the stool, and then you send it back, and they do an analysis on it and then send you a result. And it's generally either positive or negative. There's not a middle ground. It should be known that if that Cologuard test is positive, the next step in the algorithm is to have a colonoscopy. So even if that test is positive, you still have to have a follow-up test being a colonoscopy so that we can go in and look to see, was this simply a false positive and that there's nothing going on in the colon, or was there a polyp or a cancer or something else that we could identify that caused it to be positive. So that's a good test. The one downside that's been written about as far as the Cologuard test is that it is really good at picking up advanced polyps, so big polyps in the colon. It's also good at picking up cancers. What it's not as good at is picking up the very small polyps that we think can ultimately turn into a cancer. And so ultimately, again, the benefit of a colonoscopy, because it's a visual test, is we can identify those polyps and find them and take them out before they ever turn into something more concerning. The Cologuard test just doesn't have that capacity. And it's really not what it was designed to do. It's really designed to pick up those larger, more advanced lesions. I will also add there's another set of tests, and the audience might be familiar with these. These are often done either in a primary care office or in the emergency room. The old standard is the fecal occult blood test. So it's simply a little card where, again, you would take a stool sample and put it on the card, and it gives you a positive or a negative. There's a more advanced test now, the FIT test, which is done pretty widely across Erie County. I know the Department of Health provides these FIT tests frequently, and those are a little newer generation version of that fecal occult blood test, essentially looking for a particular stain within the stool that would allow us to tell you it's positive or negative, and whether you're at risk for a potential polyp or a cancer in the colon or the rectum.
Mm-hmm. And I'm going to say that if anything comes back positive, the number Dr. Ortolani just gave, 716-636-9004. Call. If you have to stay on hold, stay on hold. If you have to leave a message, leave a message. If you need to call back again, call back again. And when you get your appointment, you can always ask them if they have a cancellation list, because you might be able to get in sooner. I don't know what the schedule or anything is like, but that's just a rule of thumb whenever I go to the doctor. It doesn't matter if it's a dentist, whoever. And I always ask, is there a list, a cancellation list? And it works. They will call you back. Yeah, people will definitely.
Mm-hmm. Especially in when we get into the winter season, we'll have patients lined up for colonoscopies, and somebody will be sick or have the flu and can't make it. And usually the sooner they can let us know about that, we can get in touch with somebody on that wait list or cancellation list. Obviously, they have to do a prep beforehand, so we have to give them enough notice that they can do that.
That's true.
But you're right. It's better if we can get somebody in to fill that spot, so that we can get them done sooner than leave a spot that doesn't get filled in terms of a colonoscopy.
Mm-hmm. It'll probably make that person feel better.
For sure.
Colonoscopy, before or after, for prevention. I'm big on prevention. Are there things listeners can do to improve their eating pattern? Seeing as you said it's the large intestine and it's the lowest part that it absorbs the water. Are there things that people can do to help their colon?
Yeah. So luckily, the things that we advocate in terms of your overall health are the same things that we try to promote in terms of your colon and your gut health. The things that have been proven to decrease the rate of colon cancer are, again, some of the standard things we hear: a diet that's high in fruits and vegetables, trying to minimize red meats, so avoiding beef and steak is thought to be preventative. Exercise is thought to have a role. A high fiber in the diet, so whether that's whole wheat bread, lots of fiber-rich foods are really important. And again, we try to minimize some of the more challenging aspects, whether it's smoking, trying to minimize alcohol use. Those kinds of things are all thought to be preventative against colon and rectal cancers developing in our patient population. So we try to try to advocate for that when we talk to patients in the office, try to counsel them on these things. And it does have an effect. I mean, these are all important lifestyle changes that if patients can make, they can hopefully decrease their chance of colorectal cancer. And as I said earlier, unfortunately, we are seeing a real uptick in colorectal cancer among the younger populations. And there's been a lot of debate about why exactly that is. And one of the main things that's been pointed to is the prevalence of ultra processed foods, that patients are eating, less healthy foods, faster foods that just don't have the kind of fiber concentrations that they used to, say 20, 30, 40 years ago. And so that's why we're seeing this downstream effect on the rate of colon cancer increasing. In fact, Francesca, to the point that while colon cancer was always a pretty deadly cancer overall, when you looked at it, it was the third most common third most common cause of cancer death in the United States. It has most recently moved to the second most common cause of cancer death just in the last year. So we are again seeing a higher rate of that in the younger population, which is why we're asking folks to really be aware of any kind of symptoms they have, any family history, because this is becoming much more of a prevalent issue.
I know I had another question, but this does lead me to the next question. Are there warning signs that something could be wrong with one's colon? Is there anything? I mean, you talk about younger or older. Are there warning signs?
Yeah. So in some patients there are. Unfortunately, in other patients, by the time they notice a symptom, it may be pretty advanced. It's still obviously worth getting in touch with us and seeing us in the office and getting a colonoscopy. But the main warning signs would be any kind of rectal bleeding, whether that's blood on the toilet paper, blood mixed in with the stool when you go to the bathroom. So we always recommend to patients, even though it may be a little disgusting, to at least look at the stool before they flush it away so they can get a sense. So rectal bleeding is a big one. Any kind of abdominal pain, weight loss, changes in your stool. So if you're somebody that's used to having pretty normal formed bowel movements and all of a sudden your stools become very thin, almost what we call pencil thin, where the stool is just a much smaller caliber, that could be a warning sign. So those are all things that we ask patients to look for as potential signs of something going on in the colon, and then we can do the workup from there.
Yeah, I know that. How about I thought also if you had black stool, that might be a problem.
It can. So the way we generally think of it, black or tarry stools are thought to be from an upper GI source. Essentially, as the blood in the GI tract gets metabolized by the bacteria that's in the GI tract, it tends to turn it from the normal fresh red blood to the kind of darker, tarrier blood. So we generally think of dark tarry stools as more of an upper GI source. That being said, you can get a colon mass or cancer on the right side of the colon, the very first part of the colon, that by the time all of that blood makes its way out and you see it, it looks sort of dark and tarry. Whereas typically blood that's fresher, that's more bright red blood, is typically blood more from the lower GI tract or the left side of the colon. So, but really any blood in the stool could potentially be cause for concern, because even if it's from an upper GI source, it may require some workup. So any kind of blood, whether it's dark and tarry stools versus bright red blood, is something that's worth investigating in the office, and we can work it up from there.
I would say so. Colonoscopy. If you're doing a colonoscopy, are there any other any other diseases or anything else that you're looking for while you're doing that? Like, does something else, could you be doing a colonoscopy and besides a polyp say, oh, well, this doesn't look good. We need to make sure that the patient sees XYZ physician or something like that.
It's difficult because the colonoscopy is an intraluminal test. So we're really just looking inside the colon. We can't even really see the outside of the colon, the full thickness of the colon when we're doing this test. That being said, most colon and rectal pathology is from the inside of the colon. So it's not like we're really missing much because most of what we're looking for is on the inside anyway. Um, Most of the time, we can't see any other organ systems during a colonoscopy. I mean, we can't see what's going on inside the abdomen, the gallbladder, the liver, the kidneys. We can't see it up close. That being said, we can sometimes see effects from other organs. So, for example, in females, if there was something going on in the uterus, something in the ovaries that was large enough to sort of push on or squeeze on the colon, same thing goes for the prostate in men. We can sometimes see the effects of that during our colonoscopy, and then we would know either we could take a biopsy of something or we'd be able to refer the patient to the appropriate specialist to make sure that that got investigated. So yes, we do sometimes see pathology from other organ systems, but a colonoscopy is not a great way to test for those other systems. Usually a CAT scan or a full body imaging is better able to detect that.
Mm-hmm. Okay. We have just a couple of minutes left. Anything that we haven't covered that you would, or something you may want to reinforce that we have covered?
Well, one thing I wanted to just add, because I know, for our audience, that our group especially does colonoscopies at several locations throughout Buffalo and the surrounding area. So luckily for patients who would prefer to have their colonoscopies done at a specific site, or even if they want to be seen in the office at a specific site, we're at several locations. Where we have an office in the North Towns. We have our Buffalo General office. We see patients at ECMC. We see patients in West Seneca and the South Towns. So we also have an office in Kenmore. So we really try to be all over Buffalo and Western New York, which gives us the opportunity to see patients wherever they may live or feel comfortable. So I think that affords our audience an opportunity, no matter where they are, to get their appropriate screening tests and make sure that they're done efficiently and safely.
And I just want to say, remember when you're making your appointment, make sure you give whoever's going to give you a ride home enough time to make sure they can give you a ride home, because you can catch an Uber, you can catch the bus, you can, I don't even know if you want to walk because you may be feeling a little weak, but you have to have someone take you home, and it cannot be an Uber or a Lyft or a cab. So I just want to make sure our listeners are aware of that, because they may think, oh yeah, I can just catch, the hospital or the clinic will not let you leave in that method, and that's one of the questions that they ask: who's picking you up?
Yeah, and that's really purely for safety, like you mentioned, Francesca. Just because the medications are somewhat unpredictable and we don't know how they're going to react with every patient, we want to make sure that their patient is supervised, that they're safe, that when they go home, that they don't pass out and no one's there to right. address it. So we want to make sure that when they leave, that even though the medications are wearing off, that they don't have any ill effects afterwards. And so we ideally want to have them supervised during transportation home and then while they're at home.
Mm-hmm. How about I remember my mother was probably at least in her 80s when she had, it wasn't her first, but I remember when she had to go for a colonoscopy. And that's when I remember watching my mother in her 80s, mid 80s, something like that. And I said, if Mom can do this, I know I can do this. Is there is there any cutoff age when people don't need a colonoscopy?
Another great question, because I think that's actually it's become a bit controversial, especially as patients live longer and longer. And so we've got plenty of healthy 80 and 85-year-olds who are probably candidates for colonoscopies, but ultimately the question would be, is that a useful test? Is it really going to change anything? Are we adding any utility for the patient? The general understanding for this is that as people get into their late 70s, it's really an individualized decision. So we try to make the decision with the patient based on their circumstance. If it's a patient who's been routinely screened during their life, doesn't have any major risk factors, doesn't have a family history of colon cancer, and we're doing their scope at 77, I would typically tell that patient, you don't need another one, assuming it's normal. Now, if it's somebody with a strong family history, they've had tons of polyps during their colonoscopies, and they get into their late 70s, and they're otherwise healthy, I might say, are you willing to do another one in 3 years or 5 years, and maybe check again, just to see if to make sure we're not missing anything. So it's really an individualized decision based on the health of the patient, whether they can tolerate the colonoscopy prep, and the likelihood of us finding something.
Okay. Well, Dr. Ortolani, we are out of time for now, but remember, we can always do a part two. So if there are things that you still want to discuss, because I feel that, colonoscopies are so important. Remember, it's what Chadwick Boseman passed away in his 40s from. And I just can't say enough good things about colonoscopies, about getting screened. So if there's something that you want to, we didn't cover, and you really want to make sure we get out, we can have a part two on colonoscopy screenings.
Well, thank you, and thanks for the invitation. This has been a great discussion and hopefully valuable for the audience.
Yeah, thank you, Dr. Ortolani. And I just want to say thank our listeners. And I'm Francesca Messiah from Kaleida Health, manager of community health improvement. And we'll be back in 2 weeks with another exciting show. If you want to catch some of our past shows, please Google Kaleida Health, and in the search bar, put Great Lakes Health radio program. And not only will you see the Great Lakes radio programs, you'll see all of our communications and all of our different types of broadcasts that we have on Kaleida. So thank you for listening. Be safe, and I'll see you in 2 weeks. Bye-bye.